Did you know how to use therapy before you started? Or are you about to start therapy and you're not sure what to do? This video is for anyone who would like to know before they start, or even if they have started, what's the point of therapy? How does it work? Why am I here? Why is it being recommended to me? My name's Laura. I am a therapist here in the UK. I'm helping people to use therapy well and to know what to expect and to know what to do when they get into the therapy room. So, once you have made an appointment with a therapist and you have decided that this is the right therapist for you, then when you go to your appointment, you might not know what to talk about. And maybe you're in distress. Maybe there's a really pressing issue, which is why you've reached out for therapy. And sometimes people might expect the therapist to have all the answers, to be able to understand them completely and to give them advice and help them navigate the difficult situations in their life, and almost seeing it like taking a car to a mechanic that they're going to get fixed. Therapy isn't as transactional as that. Because the therapist isn't the expert on your life, you are. And the therapist is the expert in therapy, but how that looks for you is going to be different to their different clients because you are different. So the therapist has to get to know you and has to understand you and has to be able to implement some conditions that allow you to get benefit from the therapy. And to do this, so they have to know what's going on for you. One of the conditions that must be in place for therapy to be beneficial is that the client, comes with a problem, pre-existing problem, something that's causing them some anxiety. Might not be the clinical use of the word anxiety, but there's something that there's a problem they want to address. So that condition is on the client's shoulders. There's one more condition on the client's shoulders, and I'll get to that in a moment. The other conditions are put in place by the therapist. So one of them is unconditional positive regard. So that therapist has decided to have unconditional positive regard. Whatever you say in those 50 minutes, or however long you have your therapy session for, is going to be met with acceptance and understanding. Not always agreement, but the therapist is trying to see from your perspective and to understand exactly who you are without judgment. To do that, the next condition needs to be put in place. That condition is empathy. So not only are you met without judgment, it's paired with understanding. So empathy isn't the same as saying, oh, they're there, it's okay. Empathy is asking questions to get you to talk about what you've gone through in such a way that the therapist can understand it from your perspective. So if you speak about something, even if the therapist has gone through it, for example, I'm a mother. I gave birth. So if a client of mine is talking about giving birth, I'm not using my experience of that to empathize with them. I'm using my empathy skill. So it might be a shortcut in that I might understand some of the processes. Maybe they've had their baby in the same year as me, in the same hospital as me. It doesn't mean that I understand their experience of that. And so I get them to share with me their individual experience and I empathize with them, not with myself. I take my own experiences away. And in that way, this is why therapists don't have to have gone through what you're going to therapy with, because they know how to empathize with their client. And if they struggle to empathize, if they're not quite understanding, they know what questions to ask to try and build that empathy, right? So when that happened, how did you feel? What happened internally? What came up for you in that moment? And when you share that, therapists can empathize. Now, brings to the next condition that is the client that you would be implementing in the room. There's only two that you have. This one is that the empathy is understood by the client. There's no point in me empathizing with a client who isn't receiving that empathy. It can be really difficult to figure out if your empathy is landing for the client. And in those moments, I might ask my client, what is it that you think that I mean by that? And I will again try and empathize with them to understand if they're understanding me. And then if they say, well, I think that you're saying this and I'm not saying that, then I'm able to go, oh, okay, I've been misunderstood. Let me try again. And so, even though it is something that the client enacts, it's the therapist's responsibility to just check in on it and make sure that that's happening. So, in this way, we can see that the therapist isn't the expert on you. You are the expert on you. Therapist is the expert on helping you talk about the things that you need to. What is it that's in the subconscious that needs to come out to be spoken about? And that's one of the other conditions that Carl Rogers suggested that was essential was that you need to have psychological contact in that you need to be able to have a conversation, or at least you need to be able to understand one another, however that might look. Some people have different accessibility needs, and so not all talk therapy is going to be conversations constantly. I get to spend 1 hour with you a week. That's it. How could I ever be an expert on your life when you have the rest of that every single other hour? You have to experience your life. If you come to therapy wanting me to give you advice, or your therapist, doesn't have to be me, there's no way that I will be able to think of things that are better solutions and that are clearer and easier and more accessible than you will, because I'm not grappling with these issues every minute. I'm grappling with it while I am with you. So it's my job to help you find some clarity in that time that you're with me to figure out, so what is it that needs to be done? What's the actual problem here? Rather than you coming in and seeing what, according to maybe pop culture, is the expert, because therapists aren't experts in your life. I just wanted to read an outtake from this book. It's from, I think, the 60s. Hmm. And yeah, copyright from 1951, excuse me. So this book's been around for 76 years, right? But the way people were, their attitudes to therapy sounds like maybe it was similar to now. I'm going to read this out. The manner in which the client perceives the counselor in the interview, that's what they were used to call the session, is initially influenced very deeply by the, he uses male pronouns for the client, his expectations. The range of these expectations is tremendous. The client may have expected the counselor to be a parental figure who will shield him from harm and who will take over the guidance of his life. He may have expected the therapist to be a psychic surgeon who will probe to the root of his difficulties, causing him great pain and making him over against his will. He may have expected him to be an advice giver, and this advice may be genuinely and dependently desired, or it may be desired in order that the client can prove the advice wrong. He may, due to unfortunate previous experience with psychiatric or psychological counselors, look upon this new experience as one where he will be labeled, looked upon as abnormal, hurt, treated with little respect, and thus may deeply dread the relationship. He may look upon the counselor as an extension of the authority which referred him to help. He may, if he has some knowledge of client-centered therapy, so if you followed my YouTube channel, view the counseling interview as a place where he will solve his own problems, and this may seem to him a very positive or a very threatening possibility. Even with this enumeration of some of the most common expectations which the client brings to therapy barely suggests all the ramifications that they may have. So we know for 75 years that people have been coming to therapy with these fears. And it's time to come to therapy knowing that there's no one who can make you do anything you don't want to do. There is no one who can cause you to make decisions that you aren't ready for. You are responsible for reflecting, understanding, processing, and then acting if it's appropriate, if you need to. Therapists want you to have a free, unburdened life. Therapists want you to reduce the negative impact of mental health symptoms on your life. But they're not going to change your life unless you want it to be changed in that way. Thank you for watching the video.